I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and I'm here with another past president of the North American Menopause Society who needs no introduction for our practitioners who are out there. It's Dr. Joanne Manson. And she is the chief in the Division of Preventive Medicine at Brigham and Women's Hospital and professor of medicine and the Michael and Lee Bell Professor of Women's Health at Harvard Medical School. Thank you for coming.
Great to talk with you, Marla.
So people have been holding their breath waiting to hear about the VITAL study and what the findings were. So as clinicians, what do we need to know about vitamin D and fish oil? And tell us.
There's not going to be a blanket recommendation that everyone should take vitamin D or omega-3 supplements. However, we did find some subgroups that benefited. For the omega-3s, those who had low fish consumption, less than the average, less than 1.5 servings of fish per week, did have a substantial reduction in heart attack. They had a 40% reduced risk of MI and also a 19% reduction in the primary endpoint of total cardiovascular events. So there is a suggestion here that people who have low fish consumption maybe should be talking with their doctors, and doctors could consider, based on whether they have risk factors for heart disease, whether they may benefit from an omega-3 supplement.
And what type of dosing would we be looking at?
We tested 1 gram a day, combination EPA plus DHA, and it was a ratio of about 1.3 to 1 of the EPA to the DHA. And that's typically what's found in the over-the-counter supplements. But we tested a prescription product, which is Leveza in the United States and Omicor in Europe, so it's a quality-controlled product. And generally, that's a good bet. But if people are going to take something over the counter, they can check labels for evidence of quality control audits, such as US Pharmacopoeia, USP, or NSF or something.
That's pretty important. And vitamin D, was there a subgroup that did benefit from that?
With vitamin D, we found that across the board, there was a signal for reduced risk of cancer death. And this has now been borne out by multiple randomized trials looked at in a meta-analysis. However, it's not yet to the point where we would recommend broadly that everyone take a vitamin D supplement. People who are likely to benefit are those who have bone health problems, who have institutionalized, have very minimal sun exposure and low dietary intake. Those in older age groups may benefit from a supplement. But generally, if you're healthy and you're spending some time outdoors and having a reasonable diet, a vitamin D supplement may not be necessary. But we're not encouraging people to stop immediately, because we did document safety of the 2,000 IUs a day over 5 years. And we did see this signal for cancer death reduction, which was a 25% reduction after accounting for a latency period of about 2 years of taking the supplements.
Now, there are so many people who take handfuls of other multivitamins. Where do we stand on that kind of advice?
Generally, the overall population is not in need of taking dietary supplements. There is no evidence that generally people will benefit. It's better to get these micronutrients, these vitamins, minerals from food. They're better absorbed. You have the additional advantages of fiber and the other micronutrients and phytochemicals in the foods. So we're not routinely recommending supplements, but with a life stage approach to who might benefit, certainly pregnant women and women who are considering a pregnancy, who are not, let's say they're contemplating getting pregnant, or they're not using contraception, you want to have that folic acid in your system very early in the pregnancy. So that's a group that should be targeted for taking a multivitamin, taking some folic acid, and these vitamins in advance of the pregnancy. And also, of course, infants, there are recommendations from the Pediatrics Academy. And for people who have bone health problems, older adults, institutionalized adults, there are some recommendations for supplements. People who have conditions that interfere with absorption of vitamins. So celiac disease, Crohn's disease, post-gastric bypass surgery, people will benefit from supplementation.
So if we think of the population that NAMS is focusing on, midlife women, are there any particular vitamins that are unique to women that we would be talking about?
I think it is reasonable to take some calcium and vitamin D for postmenopausal women, but modest to moderate doses. Many women think that because the recommendation is a total of 1,200 milligrams a day of calcium that you need to take over 1,000 milligrams of calcium in a supplement. In reality, if you're getting on average 600, 700 milligrams from the diet alone through fortified dairy products, or having, the calcium will come from the dairy products, and the vitamin D will come from the fortified dairy products. You may need to take only like 500 milligrams a day of calcium. And for vitamin D, I think it's quite reasonable to take somewhere between 1,000 and 2,000 IUs a day just to hedge your bets. It seems to be quite safe.
And that safety is so critical for us to know.
Yes.
Thank you so much.
Great to be here.